I welcome you all to the final session of the second SUNIM International Development Conference, SIDC 2021, on COVID-19 recovery context and priorities. Over the last 3 days, we had 9 sessions. And actually, we had, I would say, fascinating discussions on many areas related to COVID-19 and the development challenges. And the way we framed this conference theme is that recovery, context, and priorities. There are a lot of discussions centering around those themes. The theme of this final panel discussion session is COVID-19 recovery, context, and priorities, developing countries' perspective. And we are extremely delighted to have in this panel 2 eminent personalities, Professor David Hume and Dr. Martin Rama. Professor David Hume is Professor of Development Studies at the University of Manchester, where he is Executive Director of the Global Development Institute and CEO of the Effective States and Inclusive Development Research Center. During 2014 and 2017, he was the President of the Development Studies Association. He has worked on rural development, poverty and poverty reduction, microfinance, the role of NGOs in conflict, peace and development, environmental management, social protection, and the political economy of global poverty for more than 30 years. His main focus has been on Bangladesh, but he has worked extensively across South Asia, East Africa, and the Pacific. And I'm also very fortunate to interact with Professor David Hume for more than, I think, 30 years. While I did my master's at the Manchester University long back, and before doing my PhD, so he was the professor there still at the time too, and I interacted with him. I remember I taking a course, attending his lecture. At the same time, while I was doing my PhD and post-PhD period, actually I had a lot of interactions with Professor David Hume. I remember actually one occasion, he reminded me there was a book written on Bangladesh poverty, and especially poverty in this particular Bengal, 100 years back. So we tried to revisit that after 100 years to write one piece. Actually, I did that for Professor David Hume, and it was published from Manchester University. I'm so grateful that Professor David Hume has accepted our invitation, and he is attending this session as the panelist. And now our second panelist is Dr. Martin Rama. He's the World Bank Chief Economist for the Latin America and Caribbean LAC region. Dr. Rama's top priorities, interest priorities, are to provide intellectual leadership on development issues facing LAC, to promote high-quality analytical work about the region, and to advise the regional management team on development issues. From 2013 to 2018, Dr. Rama was the Chief Economist for the South Asia region of the World Bank based in Delhi. Actually, I remember we interacted with him quite a lot, because there is a unique initiative in South Asia, what we call South Asian Economic Students Meet, SESM. It started back in 2004, and since then we are actually organizing an annual event for the students. And within a few years, after the initiation of SESM, World Bank became the lead financer of this initiative. And when Martin Rama was the chief economist based in Delhi of South Asia region, he was such an supportive person, and for all these years while he was the chief economist, and not only just support through fund, but also some academic support, and we always feel that he was with us, and also we feel that when he is actually attending this session, he's also coming back home. So welcome, Dr. Martin Rama, and and thank you so much for accepting our invitation. So just to finish, until October 2012, Dr. Rama was the director of the World Development Report, WTR 2013, on jobs. Actually, that was a flagship work from one of the very finest works on World Development Report. And the jobs report built on new research, in-depth case studies, and extensive consultations. It led to the compilation of a massive new database of labor indicators across countries. So we are thankful to Dr. Martin Rama for accepting our invitation. So with this, actually, I will invite first Professor David Hume to speak first, and I will also be his assistant in helping running some PowerPoint slides when Dr. Hume, he asked me to do that. And the expectation is that, Professor Hume, from you, because you have very vast experience on the developing countries, not only South Asia, but also African countries and the Pacific. So what do you see during this COVID situation, how these countries are responding and what is their experience? And when it comes to recovery and the context and priorities, what is your observation? So the way we'll run this panel session is that roughly the panelists will talk for around at the beginning 25 to 30 minutes. Then we'll have some times for the open discussion. Over to you, Professor Hume, and I look forward to hearing from you. David, you have to unmute.
I do, yes. Still still having my technological problems. Thanks very much for those kind words of introduction. It's great to be on the platform with Martin Rama here, and it's very kind of you all to be awake in Bangladesh at this time in the evening after your long conference. It's a great privilege for me to be able to talk to you because I respect SANEM so much. It's very important for researchers, for them to network, to get stimulating ideas, to think of the methods, to think of the theories they're using. I think SANEM is a really important sort of institution for South Asia. I've got an opening confession, which is I'm following the pandemic, but I can't claim to be an expert on the pandemic. I'm not, in a way, living the pandemic as many people are having to do in some policy positions. So I'll probably flag issues and raise questions more than I'll provide answers to them. I'm going to try to focus on developing countries, on low-income countries and middle-income countries, but that's certainly a concept that we are challenging very much at Manchester now. We've renamed ourselves a Global Development Institute, and we say we're leaving international development behind, because the idea of a global north and a global south and technology and finance transferring from north to souths and one-way learning just isn't appropriate nowadays. We are so interlocked, we're so intermeshed with knowledge, people, ideas, data, finance flowing in different directions with the rise of the emerging powers that it's very hard, and we certainly need to avoid any north and south, that there are just two sides to what's happening. One's obviously got the problems of data. There's real data problems about what's happening with COVID-19, partly because processes have been slowed down of data collection and disrupted by COVID-19, partly because of the political problems, which certainly have showed themselves in countries such as Tanzania, I think Brazil, in terms of political actors not keen that data be accurately counted. And that applies to the UK. Our government's very careful that our PPE equipment is not accurately counted and that we do not understand exactly what happened with PPE 12 months ago when the stocks were very short in the UK and they shouldn't have been. So this is not a developing country problem. Governments hiding data is a problem in all countries at the moment. There's been a whole breadth of impacts, and I'll try and talk particularly maybe about some of the social ones, because I think Martin will talk more about the economic ones, but I'll say a little bit about the economic ones. And it's also difficult because there are these incredible dynamics. We've sort of had false ideas about COVID-19. India only a few months ago was being seen as somehow a success story, or having perhaps some form of resistance or resilience that we didn't know about, but then has had this awful recent wave. Germany was seen as managing itself very effectively and keeping levels of infection down, but then Germany had a very bad wave and certainly went past the UK at stages. And so there's these waves, and certainly those early waves, we maybe thought that there was a pattern of, in a way, good management and bad management of COVID, but the waves have tended to sweep that away. And it's two final points. We were a very unprepared world for the COVID-19 pandemic, but certainly we shouldn't have been. I worked with the Cabinet Office in the UK 15 years ago, and every year in the foresights mission the British Cabinet have, then they are told that every generation, roughly every 25 to 40 years, they should expect something of the order of magnitude of HIV/AIDS to happen. But some unknown disease and that. And, HIV/AIDS, it's killed about 30 million people, a lot more people than COVID-19 has at the moment. But these are not unfortunate incidents. These will happen. We may not know when, but these sorts of shocks are going to continue to happen. Okay, I'm going to start grand with global, sort of looking at the global scenarios, but I'm going to finish, when I finish, I'm going to finish on what can researchers and that do. If I could just go for the first slide, which maybe helps wake us up at this this time in the evening. Back in 12 months, well, 13, 14 months ago, if we go for the good, the bad and the ugly one, Rory Horner and I, a colleague at Manchester, were looking as the pandemic started off, and we tried to create a number of scenarios. The publication that came out of this is at the resources at the end of the presentation on this PowerPoint. But in a way, we looked at the good, the bad, and the ugly scenarios about what might happen. We started with the ugly, and we looked at the possibility that there would be an apocalypse or a real global crash, that growth would, fall 20, 30%, that incomes would be transformed, that political disconnects would occur. We saw that as a possibility, and I must be honest, I was probably more pessimistic than my colleague Rory. I did worry very much about a parallel crisis in finance, or perhaps in IT platforms occurring, and that if we had a pandemic plus a financial crash or a technological crash, that then the world would be a very different place, and we'd be moving into a really difficult scenario for 10, 20 or 30 years, with perhaps the breakdown of law and order, democratic erosions, and a real collapse in international cooperation, a US-China confrontation of some sort, or maybe Russia playing bad boy. Luckily, that ugly scenario didn't happen. We looked at a bad scenario, and what we call the bad scenario was basically that after the pandemic, we'd return to the world as it was in 2019, a world in which there was growing inequality, certainly within countries, if not across countries, in which climate change was actually causing more and more problems, particularly in countries such as Bangladesh, which are very much on the front line of having to face a very different world because of the problems that climate change will generate. And this certainly, in a way, meant that we were looking at wealth inequalities continuing, at opportunities and life chances continuing. Our scientists at Manchester tell us that they still think 2 to 3 to 4 degrees Celsius is the most likely scenario. Is this optimistic rhetoric, but the technologies for carbon capture that are required are not yet working on any scale in the world commercially. And so there's a lot of technology to be developed in a very short period of time. And in a way, Rory and I, when we look back now, we think that our bad scenario, which is what we said was most likely, is the one which has actually worked out, that the world is continuing to get more unequal, and certainly the work of economists such as Thomas Piketty and Angus Deaton is indicating that, and that climate change remains a major problem, and we haven't got global leadership to tackle it. The good scenario was the one that we encourage people to look for, but that would be following the idea that you never waste a good crisis. A crisis is an opportunity to improve institutions, to improve policies, and we look towards the possibility that there might be renewed multilateralism because of the pandemic, building on these ideas about we're all in it together. Nobody is safe until everybody is safe, and there might be a wave of investment in global public goods policies, nationally and internationally, for more inclusion. But that certainly was too rosy. We don't see that the world has changed dramatically for the better in terms of the policies or the processes which are operating, and it hasn't been a period in which we've been able to strengthen our international institutions. I think at this stage we don't need the slides for a while then, Salim, so we can turn those off. So I'm going to think quickly about some of the impacts on that. And when you're thinking of impacts, then I think there's still this framing of impacts in terms of lives and livelihoods. And that is that we're thinking about the health and mortality and morbidity problems, but we're thinking about the economic and maybe the related social problems that are happening. I think that that's useful and we need to be thinking of both, but sometimes these are presented, and certainly in my own country, the UK, they're presented as a trade-off. You can focus on health or you can focus on the economy, but you can't actually work on both at the same time. And Angus Deaton, certainly in his work earlier on this year, has actually been looking at this and points out that no, that's not the case. Countries that have managed to reduce the health problems and the mortality rate have tended to have higher rates of growth and have tended to do better. So in a way, governments need to be working out how they work in both of these domains so that we reduce mortality and morbidity, but also that we can maintain rates of economic growth and contain particularly employment processes on that. So I think that's very carefully. If we look at poverty, I'm probably assuming that Martin's going to talk more about this, but certainly the World Bank data shows the way that we have 88 to 115 million more poor people in the world, that the last 30 years of a continuous reduction in extreme poverty has gone down, and that if we start to use some of the higher poverty poverty lines, such as the $3.20 poverty line, then one's looking at 175 to 225 million people have fallen into poverty in the last year, most of those either in South Asia or in sub-Saharan Africa. So certainly on the poverty front, COVID has been a disaster. The progress that had been made has been reversed. On inequality, the data is complicated and there are different interpretations of it, but I've been looking at Angus Deaton's, and certainly Angus Deaton points out that that low-income countries don't appear to have fallen behind, but that global inequality has been increasing because growth in China has continued, perhaps at a slower rate, but it's continued. So we have 1.4 billion Chinese people who are getting wealthier, as against in India, 1.4 billion people who in per capita terms are getting poorer. And that tends to mean that it's actually the emerging powers are driving actually increases in inequality. But certainly when one looks beyond the quantitative, but some of the qualitative work that's been done, then there's a lot of evidence pointing out that within countries, poorer people have been able to, in a way, manage the COVID impact much less effectively because they have fewer resources, fewer social networks, lower access to public goods and public services, lower savings, and that this has tended to drive inequality up and may actually establish deepen inequality, particularly where people have to go for distress sales when they're poor, and they are ending up reducing their productivity levels. Let's think though about some of the social and political impacts. Certainly, I mean, one of the ones which has been pointed out in Bangladesh by the work of Education Watch and by the work of PPRC and Brack University's BIGD, the Institute of Governance and Development, is the learning loss that's happened. And the fact that certainly according to the PPRC BIGD estimates, around about 6 million children in Bangladesh negatively impacted on this year. They've achieved much lower learning than they have done, and this potentially has implications longer term for literacy and numeracy. And there will need to be both private action at the household level, community level action, and public action to try and catch up with this learning loss. Otherwise, the skilled workforce that's needed, the types of skills that are needed will not be in the supply that they would have been. We know we have problems with education in Bangladesh and public education, but these have been deepened. When one looks at healthcare, then there's obviously the awful increased mortality rates that have occurred in many countries around the world. And I've only been following Bangladesh and seeing some of the problems, which certainly don't seem to have been as severe as India and as the horrendous situation in Nepal at the moment. But clearly Bangladesh has suffered. We've suffered in the UK. We've been leading Europe in terms of having a very high additional mortality rate because of our initial problems in managing it. But perhaps if one's thinking of health, one needs to certainly think about the future and think about the foregone healthcare. And There's a lot of evidence in higher income countries about foregone healthcare. In the UK, we have 5 million people who have not been treated by the National Health Service, who usually would have been. And that converts into increased and more serious levels of cancer, of heart disease, of diabetes, and a whole set of things. But Uganda, and I'd encourage you, I was trying to find the reference, but couldn't find it just before. Uganda has been having a rapid phone survey based upon, it had a sample frame for a household level survey done in 2019, and it's been following that up by phone 5 waves, and it shows the way that when you look at the population in Uganda, particularly the poor population, which doesn't have good access to healthcare, but even the poor population has been putting off and reducing its demand for healthcare services, and this will convert into additional problems in the future, probably with the types of chronic disease that have been becoming more common even in low-income countries. So we can expect those problems to arise, and we need to be looking as part of any recovery package at how do we get people who need treatment and have delayed it into services. Neglected, I think, in many countries and many lower income countries has been mental health. Mental health services are poorly provided for in most low income and middle income countries. Work on mental health is quite difficult when you can only do it through the screen and you can't meet people face to face. But again, the Ugandan rapid phone survey indicates that something just under a doubling of the reporting of people suffering from severe depression, feeling anxious and not feeling that they can go about their daily lives with the energy, vigor, belief in the future that they had. And certainly mental health will need, I think, looking at in Bangladesh, in South Asia, as much as in other countries. Gender has certainly been highlighted by some of the work which our effective states and inclusive development researchers have been doing. Suhela Nazneen, who used to be at Brack University, who's now moved to Sussex, but we've been working with her teams. And the evidence is that certainly on domestic violence, and that lockdowns have been associated with increased levels of domestic violence, and most of that violence is against women. But we also know reporting sometimes quantitatively, quite often qualitatively, of the increased double burden of work for women, who are seen as in a way, the carers for the household, so that if somebody falls sick, if there has to be some response to the pandemic, then women are expected to take that on, as well as do the work that they're doing. There's a set of other ones, but maybe the one to mention is particularly looking at reverse migration, and the fact that certainly in many low-income and middle-income countries, but also actually in parts of the rich world, then people have moved to looking at suburban or rural existence, partly to get away from hotspots where the pandemic is bad, partly because they're finding that the rural economy may not have collapsed at the same rate as the urban economy, particularly the urban informal economy, which has been highly problematic, as the sort of PPRC Big D survey has shown, that the people in the urban informal sector in Bangladesh have found it very difficult to cope with the pandemic. Less social protection, less social networks that can help, fewer resources to pull in. Let's move a little bit to thinking about the political, thinking maybe initially about it at national level, but then thinking particularly at multilateral level. I'm aware that time's moving on, so I'll move quickly. COVID-19 has certainly, caused many governments problems dealing and manage with it, but some governments have been hiding behind it and actually have been eroding transparency and accountability, maybe becoming more authoritarian because of that. Magufuli in Tanzania, who's already becoming very authoritarian, was doing that. Bolsonaro in Brazil, Modi in India. Donald Trump calling for the US Capitol to be stormed at the end of 2020, a whole set. In Europe, we've got President Orban in Hungary. And there's no time to go into in detail, but this really is quite interesting in the way that science and knowledge creation interlocks with politics, and the way that the relationships have deepened, sometimes deepened so that scientific knowledge can be applied, but sometimes being controlled so that scientific knowledge and analysis is discouraged if it's not meeting the needs of political elites. Looking at multilateralism, then we haven't had the ugly scenario of it collapsing, but we haven't got much evidence that it's been improving significantly. And that opportunity to renew multilateralism, to re-energize it after it had had a bad 5, 10, 15 years hasn't been taken on. We've had glimmers of hope with the changes in the leadership in the USA and the arrival of President Biden, but certainly last week's G7 summit and the reports on it have not been encouraging. If you look at Thomas Piketty's work, he argues that actually we're going for a race to the bottom with this 15% corporate taxation level, that actually this is going to allow wealthy corporations and wealthy people to actually not have to increase the contribution that they make to society. With climate change, the UK has been talking about the leadership it will provide at COP26, but it's been looking at opening new coal mines, and it certainly hasn't been meeting any of the promises about the dramatic changes. We're making big promises, but the day-to-day changes that are to deliver those are not happening. The real stark contrast, I think, and if we come back to the slides, is if we contrast vaccine development with vaccine distribution. And vaccine development is a story of success, and often of success in international linkages, international scientific collaboration, about effective public-private partnerships. A vaccine was developed within about 260 days, where people would have said, no, it's probably going to take years, and perhaps 5, 6, 7, 8, 9 years. So there's been, in a way, effective public investment in high-income countries, in China, in Russia, to develop a whole variety of vaccines, and these vaccines seem to be working out. We've had the establishment of COVAX and the creation away of an institutional form for delivery. But when we look at vaccine distribution, then it's this very different tale that we've got. If you can see the very bottom of that diagram, the little blue low income, then vaccine distribution has hardly occurred in low income countries at all. It made great progress initially in the high income countries. It's moved into the upper middle income countries, but the lower middle income and particularly low income countries are getting next to no access. High income countries, about 1 in 4 of our population has been double vaccinated or single vaccinated. Low income countries, it's less than 1 in 500. So there is this incredibly stark gap between the international collaboration that created the vaccines, but then the access to the vaccines. And you know, many of you work in different contexts, but certainly in the UK, where I'm involved in advocacy, we really have to point out our Prime Minister said in February 2021, he pledged that every single surplus vaccine will go to poor countries. A task force identified health workers as being on the front line in poor countries, and we needed to get the vaccines to health workers. How many vaccines have we transferred? 0. Was the record yesterday. We've not transferred any vaccines to these high priority health workers there. So that really supports the bad scenario. It makes recovery much slower than it needs to be in poorer countries. It means that their health workers are not protected in the way that we might want. What to do, what to move forward? Let's move very quickly on a few final points. We could present the need for a panacea, that we need good national governance and multilateralism breaking out. I'm not going to do that. I could have a long list of wishes about things that governments would do. But I was actually going to say, what can analysts and researchers and economists do? What can you do about it? Well, I think the basic message is keep on doing what you're doing, but do even higher quality work, make it more policy relevant, make sure that you're focusing on poverty and inequality, on the social dimensions, what's happening in education and health, as well as in the economic dimensions, and certainly that you're thinking about gender and also identifying these new poor groups that, again, the PPRC, big BIGD workers has identified, looking at the urban informal sector and or groups that are particularly have been disadvantaged. Adopt the new methods that have been developed. using mobile phone surveys, using lower cost approaches to collecting data. I think we will use some of these in the future, and that we'll find that expensive surveys, which are quite long and time consuming and need lots of management, we may be able to shift, but we will need to check whether we are missing out the poorest people or whether there are particular people, if we switch to mobile and telephone technologies, who we are missing out with. A particular thing I think we need to do in South Asia is share data. South Asia, as in many parts of the world, but in South Asia it's very deep, has a deep tradition of people keeping their data and not sharing it. But COVID-19 shows that we need to be analyzing it, but we need to be sharing it, because historical studies of what was happening in 2020, yes, they'd be fascinating to read, but we need to be fitting into policy now. And finally, I'd say we need to be thinking about public understanding, about the collaborations with NGOs, with think tanks, between academia and between the media, and building trust in the way that SANEM has contributed to this. We really need to keep on with this. Thinking about the policy messages, not purely about the very sophisticated analytical results we've got, trying to connect with the school syllabus and feeding evidence into that, fostering the reputation of researchers and knowledge creators. If we've got disputes, then making sure that those are carried out in a dignified way so that people understand that they can trust analysts and researchers, even when they disagree, and explaining that. And I really think that. And finally, in Bangladesh, well, and in the UK, we need to push forward the public understanding, the need to support COVAX in rich countries, to move away from rhetoric, to challenge vaccine hesitancy, and to really get people to understand that we can manage this, we can be more resilient, but we will need to listen to the research and the science. Okay, sorry, I've probably talked on too long there, Salim. Over to you. There are some resources at the bottom of the PowerPoint, so if that's shared, then people can click on some of the things that I've been using.
Thank you so much, David. Actually, I will definitely share your PowerPoint with the participants, but you covered a wide range of issues and so relevant issues. I think this will be very, very important and extremely useful for the open discussion. Now, I'm very happy to see Imran Motin, Mirza Hassan, and Ganga Tilakaratna. Many of you know them very well, so they're here too. So I welcome them to ask questions during the open discussion session. I think now I should invite Dr. Martin Rama. And Martin, thank you so much again for being with us, and I look forward to your speech. At the same time, just to let you know that our friends from SEISM Group, they're also here. Dr. Dev Kushum Das, Navin Adhikari, and others, they're here too. So probably they will also ask questions to you after your deliberations. Over to you.
Thank you, Salim, and thank you for having me with you. It's a pleasure to be back, although honestly, I would prefer to be back for real in Dhaka with all of you. I'm delighted that you're doing this, and I'm delighted to be part of the event despite having moved on, at least temporarily, from South Asia for the last couple of years. Of course, it's difficult to have a talk as engaging as that of Professor David Hume, so I will try to keep you awake and energetic, but I'm not sure I can match that delivery. I want to talk to you about the topic of this session, using the experience of Latin America to motivate the talk, because Latin America has been the most affected region in terms of the pandemic, the most affected in terms of health, the most affected in terms of economy. But I want to, in the kind of implicit division of labor we have had with Professor David Hume here, to go more on the data and modeling, more the kind of SANEM kind of issues, and not so much on the social and political, which are, of course, as important, if not more. But let me try to speak to this audience. And I want to address several things. First is getting the data right on how bad the pandemic was so far, because it's not over. And for developing countries, it is far from being over because vaccination is proceeding very slowly. Second, to highlight a few things that worked out a bit better than we anticipated at the beginning of the pandemic. So there were some good news, and I want to report on some of the good news. And then I want to go into perhaps what will be the core of my talk, is what to expect. And I think there are very good reasons to expect the bad and the ugly, not so much the good, as Professor David Holm said. And but I want to be a bit of a contrarian and to make the claim that, well, we may face something that resembles a strong recovery. And the problem will not be there. The problem will be on the implications for inequality, or the problem will not be so much there on the growth side as it will be on the implications for inequality and the new challenges we face. So in the process, I will discuss a few modeling issues here and there so that I feel a bit more Sanem connected in this situation. So let me share my screen and go through a few slides.
Let me allow you to share your screen. Sorry.
Oh, okay.
So, yes, you can now, please.
I can, okay. Can you see my screen now?
Yes, if you can put it in the full screen, yes, that's fine, perfect.
So this is our semi-annual report, much the same as we used to do in South Asia. It came up, the title itself tries to bring the issue, how do we renew with growth? One first thing we do is to assess, so how bad was the pandemic in terms of deaths and in terms of economic cost? And in terms of deaths, the problem is not all countries have the ability to test, not all countries have the will to test, not all countries classify deaths in the same way. So one thing we did was to measure excess mortality in a credible way. Some people model excess mortality. I'm not a firm believer on that. We went for countries where we did have real data on excess mortality. So here you have, this is for 2020, and things have changed a lot with the second waves and third waves we're having in several countries. But here you have for 2020, the official COVID deaths per million people in the horizontal axis. And here the excess mortality also per million people in the vertical axis, with excess mortality being the death of 2020 minus the death in a normal year, with a normal year being the last 5 years before the COVID, the average of the last 5 years before the COVID outbreak. And each dot in this figure is a country, and the 45-degree line is where you will expect things to be, sort of, if the two measures were equivalent. Now, they turn out not to be equivalent. You see that most countries are on the upper side. Doesn't need to be that way. Several countries have negative excess mortality, and that can be understood. You shut down traffic, you have less pollution, you have less stress from work, although you have other forms of stress. And some countries, Japan, Uruguay, my own country, had a strong negative excess mortality during 2020, very different 2021 when the Brazilian variant arrived. But what you see is that the Latin American countries, which are the ones that are in purple, tend to be above. So if we just take a regression line, around the world, one death, COVID death was 1.3 deaths in excess mortality. In Latin America and the Caribbean, it was 1.9. Now, you may say this suffers from biases, sample biases, because the poorest countries do not have good data on mortality. And so we may be looking at countries that have some good systems. Some, like Nicaragua decided to ignore the pandemic, didn't test, so Nicaragua appears to have 0 deaths from COVID, but has huge deaths. Others very different. Brazil, which has a good healthcare system, is more or less on the line. Mexico, at a similar development level, but with a much weaker social services, has twice the mortality. The worst offenders in the world are the Andean countries. That's where it was the worst. But we have a few countries that are low-income countries in the summer, or relatively low income. And we again find a 1.3 ratio. So there is something about Latin America. Also, Latin America and the Caribbean was the region that has the strongest decline in GDP. This is in purple, Latin America. The only other region that was comparable was South Asia. not because of Bangladesh, not because of India, which of Pakistan, which had declines in the order of less than 1% of GDP, but because of India. But when you combine the two, we can tell from the region I'm working for now what the full impact of COVID is, and we are not out of the woods yet. Now, it is interesting when we combine this information on economic impacts and health impacts, that countries are in very different positions. So here again, in the vertical axis, you have the same excess mortality per million people we had before. Okay? The same figures I had Peru all up and Nicaragua appearing as zero officially, but then having. And then we have the decline in GDP from the crisis, which we measure in a very simple way. We say, let's take the forecast of growth for 2020 we had in January of 2020, and let's see what the growth, the actual growth in 2020 was. Of course, there were other shocks. COVID was not the only shock, but it was by far the biggest. So that change between the forecast and the actual is an indication of where countries were. And you see that the countries in the world are scattered all around. Again, countries like Peru, Bolivia, countries in the Andes in Latin America were the worst on all counts, like 15 percentage points decline on GDP. And it is just in 2020, we're talking 1 year. And 3 per 1,000 people dead. But you also have countries like Taiwan, Korea, Norway, Japan, that had relatively good containment. Even with good containment, it's worth noting that with good containment, you still have 5 percentage points decline in GDP compared to the forecast. And then you have a combination of countries with a relatively low death toll, but high economic cost, and the opposite. And so here, that shows, I think, a combination of two things. One is preference of politicians. Some have favored health containment, some have favored the economy, although as Professor Holmes said, these two may go together. But in addition, there was the limited knowledge. Because when you look at Peru, Peru on paper did everything by the book. Latin America was looking at Europe, but looking at what happened in Spain and in Italy when the virus arrived. And Latin America went into massive lockdowns. In some cases, like Argentina, 6 months basically of lockdown. Some of the longest lockdowns in the world, and I will come back to that. And yet it didn't work. Why it didn't work? One can speculate about several reasons. It's not the same to lock down people in informal countries where people need to go out anyway and will try to avoid, because you cannot pay them a salary because they are not salaried anyway to begin with. It is not the same to lock down people, to have them in lockdown in overcrowded slums or with lack of water and sanitation. That's probably a recipe for all of them to get sick where they are living. But we have this huge dispersion of results. Now, when it goes to the relatively good news we had and we didn't expect, the first one is trade in goods, not in services, not tourism. Trade in goods has bounced back. Trade in goods is back to the levels of before the pandemic, with an important change. Before the pandemic, China accounted for 18% of global trade. By now, it accounts for 24% of global trade. So at a time when there were all sorts of policy measures to try to rebalance trade, we got the opposite rebalancing. When people needed masks, they came from China. When people needed medical equipment, came from China. When they needed computers to work at home, they came from China. And the West wasn't locked down, so it was not supplying. And so now we have a situation in which China is booming, and that translates into higher commodity prices. Commodity prices were entering something that starts resembling the beginning of a small commodity boom again, which is very disturbing in this context. Part of it is supply bottlenecks. Part of it is a surge in demand from economies, and I believe India will follow soon, that absorb quite a lot of natural resources and food. Second piece of good news, and this I will be interested to compare notes with Bangladesh, is remittances. Months after the pandemic, we forecasted at the World Bank that remittances to Latin America will decline by 19.3%. We got it right, except for the sign, which we got wrong. Basically, remittances surged to Latin America, and that's very important for the poor. In some countries, like Haiti, in the Caribbean, like Jamaica, and especially Central America, remittances account for a big share of household income, a big share of GDP. Why they held so well? Part of it is solidarity. Part of it is that many of the migrants, and here there can be a big difference with Bangladesh, many of the Latin American migrants work in the US. They work in sectors like construction, grocery shops that were not shut down. And the stimulus packages that the US had during 2020 and is now having in 2021 were very generous. So in fact, poverty fell in the US during this period. The same as in Brazil, by the way. Brazil had such a generous program of social transfers that poverty and inequality fell during the pandemic. Third piece of good news is that access to international markets, financial markets, was preserved. When the crisis started, in the first few weeks of the COVID outbreak, more short-term capital left developing countries than during the entire global financial crisis. So we were feeling the worst. But after some time, country risk premiums, what you see here, the interest rate addition that you have to pay because you are seen as not a very safe debtor, have returned to the levels where they were before the crisis. In fact, in 2020, Latin America issued more debt in international markets than in 2019 at lower interest rates than in 2019. So these three pieces of good news give us some elements of relief to think about the near-term outlook. Now, on the near, I will skip this figure. On the near term, and I will come to something that's really modeling now. On the near-term outlook, the first thing to note is, again, we are not out of the pandemic. If you look at what is happening now in Latin America, especially as the Brazilian variant spread, even countries with very high vaccination rate, Chile, I think, is the 5th country in the world in terms of vaccination rate. Santiago is under lockdown at present, with something like 40% of the people having 2 doses of the vaccine. That's not enough. So even with countries with capacity and vaccines, we are not off the woods. And that's a reason to be cautious about what will come. There are also economic reasons, but I want to get a sense of, so what is happening in real time? Because even the measurement of economic activity has become more difficult because of COVID. We cannot conduct the surveys in the way we used to do. We do not know exactly how to account for people working from home. What is the impact on productivity? So one first thing, again, as I started with the deaths, data on deaths, and say, how real are these numbers? A question we asked ourselves is, how real are the GDP numbers we're using these days? And we have been working with my team on something that's coming up now as a publication soon, which is to use satellite images to estimate economic activity. This is something that had been done before since Henderson, night lights. We have used it in South Asia. But the thing is that lights are not too sensitive to economic activity. And especially the richer you are, and Latin America and the Caribbean is a relatively like upper middle class of the world relative to other developing countries, people don't switch off the light. So you see more of the growth in long term with night lights. You see much less of the short-term fluctuations. So we changed what we measure from satellites. And what we measure is nitrogen dioxide emissions. Nitrogen dioxide emissions are what comes out of chimneys, of exhaust, of combustion. It is very human related. It has one more advantage. It doesn't travel. So with wind, it doesn't go too far. So you basically, where you measure NO2 is basically where it was generated. And the good thing is that NASA every day puts in the public domain unclean data on NO2 emissions all over the world in tiles of 100 kilometers by 100 kilometers. And so what we did is to clean this data so that it could be comparable, because all of this is like big data, massive work. And then to link it to GDP going back. And of course, the relationship between NO2 emissions and GDP is not the same in all countries. A country with heavy industry will have a lot of emissions per unit of output. A country that specializes in finance and tourism will have little. But we managed to compute, we believe, rigorously an elasticity of NO2 emissions to GDP per country. And we used that to reconstruct GDP quarter by quarter. So what you see now in your screen is what happened to GDP, not NO2 emissions, not nitrogen dioxide emissions, is already GDP, in the first quarter of the pandemic, which was Q2 2020. And these maps I will be showing you are relative to the last normal quarter, which was the last quarter of 2019. We don't use Q1 2020 because Q1 2020, China was already going into lockdown. And you see that the falls are dramatic, often more than 12% of GDP. Even in a country like China that was growing at 6%, you go into the negatives. The red colors are negatives. This is the next quarter. Again, relative to the last normal quarter, to the last quarter of 2019. You see that the reds are not that dramatic because some countries are starting to ease, but we are still in the reds with a couple of exceptions, China and Vietnam. There we start to be in the positive. Here is the last quarter of 2020. There we see Europe in really still a very difficult situation. But for instance, we start seeing India on the positives. And that makes us think that perhaps we are having an issue with the data. Of course, Indonesia, a few Latin American countries. And here's the disturbing thing, but we are quite comfortable about the results. Here's the first quarter of 2021. And except for Europe, it's already in the blues, very light blues. That means we still lost like a year and a half in terms of growth. So we are still below where we should be. But there is something going on, and you see that Asia is a very important part of the story. Also, some of the countries, the mining countries in Latin America, countries heavily dependent on China's demand, like Uruguay mine, are there. So this makes us a bit dubious. So what should we expect for the longer term? And this is what I want to spend the last part of my presentation. Of course, there are very good reasons to be very negative about what will happen in the longer term because of COVID. The first one, already mentioned by Professor David Hume, is we have lost a big chunk of a year of human capital accumulation. This is the number of days with schools closed, the percentage of days with schools closed across countries in Latin America. What we did, a very simple calculation, we took the Minserian returns to 1 year of education. These bars are the Minserian, every decade or so, the World Bank estimates these returns for every country. And we took away the part, we assume every day the school is closed, you don't learn, every day the school is open, you learn normally. It's very simple, but in many countries there was no distance learning available, and distance learning is a good complement, it's not a substitute for the real thing. And so the green part is the return that was lost. For instance, if you have 1 more year of education, on average, you are expected to have 10% more earnings in the future for the rest of your life when you're an adult. Here, the loss was much bigger. And when you look at across regions, Latin America and the Caribbean, which was the region with the longest lockdowns, is the one that suffered the most. So human capital, first reason. Second is there has been massive job losses. This is from household surveys, not telephone surveys. This is what happened to employment in the second quarter of 2020, the worst moment of the pandemic, and by Q4. You see that the losses in some cases were up to 50%, 20% in employment. Always bigger for women in purple, larger for women than for men. Even almost 1 year into the pandemic, 10% of employment loss. And when we look at this from telephone surveys at what kind of jobs people have, what we see is a substantial growth of this blue part from 33% to 38%. That's self-employment. Those are bad jobs. The good jobs shrank from 61 to 53. So second reason to be pessimistic, less attachment to the labor market, scarce, less female labor force participation, wiping off gains in gender equality that we had over several decades, worse jobs. So second reason to be negative. And the third one is, of course, the over-indebtedness. And here you see what we show here is two lines for countries in Latin America, Brazil, Chile, Colombia, etc. One is what happened to public debt over GDP in blue after the global financial crisis. And you see that it was contained. In some cases, even because GDP was growing fast, debt over GDP did not increase much. This is the first year of the COVID crisis and our simulations beyond. Basically, countries in Latin America and the Caribbean added on average 10 percentage points of GDP to the debt. And this is not the US, this is not Europe. Countries in this region cannot print dollars, cannot print euros. So this is something that is a problem to come back to context, especially at a time when the US is having such an extraordinary pro-cyclical policy. So injecting enormous amount of money in an economy where there are supply constraints, that we are bound to have inflation and high interest rates. High interest rates, this kind of debt is manageable with zero interest rate, because then you can just roll it over. If interest rates go up, we can be ready for a new financial crisis, and Latin America has suffered a lot from that. So in that respect, is concerning. The US policy has the good thing. The US is injecting 4% of global GDP to its economy. It cannot respond in production in that way. So this is really a blessing for countries like China and Vietnam, and to some extent for Latin America, which will be able to export a lot to the US. But when it comes to interest rates, it will be a problem. So how can I be optimistic in the middle of that? How can we have this loss of human capital, this loss of employment, we have this over-indebtedness? If I pick up the slide by Professor David Hume, I'll say, well, it's not the bad, it's the ugly, it's really the ugly what is waiting for us. And yet, when you look through history, what happened after humongous crisis was a booming economy. The Spanish flu, which came after World War I, a terrible loss of life, was followed by the Roaring 20s. World War II was followed by the strongest phase of expansion the world economy has known. Some researchers, Mansur Olson, had written about the rise and fall of nations, with this idea that when you get this kind of havoc, you also get a lot of restructuring, a lot of creative destruction. And I want to ask the question, so what can we expect from creative destruction these days? And what we saw is that over this first year of COVID, sectors like ICT, communication, information technology, logistics, finance, boom. Just look at what happened to Amazon, or what happened to Apple, to all the tech companies. And sectors like personal services collapsing. Now, you may say this is a temporary thing, and it will be we will get back to where we were. But there is a chance that we will not get back to where we were. That will somehow this crisis has given a push to technology that was phenomenal. Perhaps in a way, something similar to what Modi tried to do in India with demonetization. Demonetization was a crisis that forced people to use electronic means. But this was on a global scale. And so what we did was a very simple calculation. We said, well, let's take average labor productivity by sector, and let's compute the labor productivity of the economy as the weighted average of productivity by sectors with two sets of weights. One before the pandemic, so the size ICT, finance, personal services had, and one at the end of the first year of the pandemic. Of course, this is a very crude calculation because there are substitution effects. We will need computable general equilibrium model to do it right. But it's just a first order of magnitude. And what we get is that for countries like Chile, Brazil, Mexico, the gain, just the composition effect, if the economy bounces back to full employment with the new structure, is about 5 percentage points. Not in all countries, Ecuador and Argentina, but Ecuador and Argentina were countries that were in crisis before COVID, serious crisis before COVID. Now, there's one more thing, is that the sector that is expanding which is technology, also transforms other sectors. It offers the opportunity for a region like Latin America to finally be serious about formalization, because now, if you remember the cover of the report I showed, is motorbikes of deliveries. You are in a Latin American city, traffic is made of motorbikes of delivery. Let me go back to the picture so that you understand what I'm saying. You see, these are motorbikes of delivery. That's a bit of an excess. It's one particular extreme example, but today, Latin American cities start looking like that. Sorry, I'm going down again. And so the question is, if we can formalize these people, because we know how much they work, we know how much they earn. There's no reason. This is not a problem of technology anymore. This is a problem that we have not designed our social protection so as to include them, but we could. We can get much more financial inclusion, because the financial sector in Latin America is dominated by big, solid banks, and people do not have so much access to payment systems, and this is booming now. We can have more trade, because you can sell through platforms without all the hassles of going through customs and things like that. A lot of people are teleworking. And so what we did, and I will not go into detail in this, is to benchmark how ready Latin America and the Caribbean is for the digitization wave. We looked at 8 indicators. Every time the Latin American bar is in green, and you can always look for South Asia. This is the overall telecommunications infrastructure, the number of active fixed connections to the internet, the number of active smartphone subscriptions. This is a bad news. The cost of broadband, where South Asia does much better. The cost of mobile, where again South Asia does extraordinarily well. The average broadband speed, and the exports of ICT services. And again, we have some of the global leaders in exports of ICT services per capita in Latin America. And what is, and I will finish with digitization of government services. I will finish with this because I think it's very relevant for countries like India and Bangladesh, which is when you think about growth in the Schumpeterian way, what you want is this creative destruction where you get new firms that change things. The railways that, of course, destroy the stagecoaches, and the stagecoach sector suffers. And of course, if you are a Caribbean island that depends on tourism, and the stagecoaches today is the tourist sector because nobody wants to travel because of fear of contagion, then you're in bad shape. But if you are the one producing the railways, then you are in good shape. And in firm dynamics, this has been the literature on gazelles. Gazelles are these firms that grow very fast, expand employment very fast, and create a lot of dynamics. The ultimate gazelles are the unicorns of ICT technology. And there are not many unicorns. These companies are still privately owned, that are funded by venture capital, and that reach a value of more than $1 billion. There are about 500-600 of them in the world. Companies like the ones that are behind us, those deliveries, Rappi in Colombia, Pedidos Ya in Uruguay, are of that sort. And so what we did was to compute what is the wealth of unicorns relative to GDP by country, and what is the number relative to their population. And again, the Latin American countries are in green. And of course, you get the usual suspects. You have a lot of wealth in unicorns in China, the United States, in India, and Sweden. But very quickly, even the United Kingdom, very quickly, you come to Brazil, Argentina, Uruguay, Colombia, a bit Mexico, much less. Most European countries are on the left tail here. Latin American countries are on the right tail. Of course, if you do it in relative to population, the smaller countries, the Estonias and the Singapores and the Switzerlands gain in their position. And the United Kingdom is always, and Sweden are always well positioned. But again, I want to finish with this because it's a tale of potential, but inequality. Latin America and the Caribbean has about 30 countries. We are talking about half a dozen countries that have this potential. And I want to finish with this example that goes back to structural transformation and the challenges ahead. One of the countries that was worst hit by the pandemic in Latin America and the Caribbean was Argentina. Argentina had, as I said, 6 months lockdown on an economy that was already in crisis completely. The GDP of Argentina in 2020 fell by 56 billion US dollars. Okay? That's quite a lot of money. 56 US billion dollars were wiped out. That's GDP. That's tax base. That's what you use to raise money to pay for schools and clinics and all you need. Over the same year, 3 technology companies of Argentina, 3, just the top 3, Mercado Libre, Globant, and Despegar, saw their value increase by $66 billion. Okay? 56 down, 66 up. Of course, this value is not GDP, is not domestic, not entirely domestic. It has not materialized into income gains. But that, so if you were to count it, you would say, oh, it was a good year for Argentina. Plus 66 minus 56, I'm on the positives. I'm caricaturing, it's very simple. Except that those 66 are out of the reach of the Argentinian government for taxation. The government of Argentina spent as many months trying to raise taxes from the rich as it spent in confinement. There was a very active plan to try to put a 2.5% wealth tax on the rich to try to get out of the pandemic, and it raised 0.5% of GDP. So, and one time, and basically pushed several of these companies to neighboring countries. So we have in a situation in which within countries, so again, let me summarize the message. We have many reasons to think that the bad and the ugly are coming on us, and maybe they will. We also have elements to believe that we may be entering roaring 20s again, literally roaring 20s, with China booming, demand for commodities, with the US running the mother of all current account deficits and importing big time, and with this booming technology being transformational. But first, you saw from my maps, access to these technologies reaches at best half of the population in Latin America and the Caribbean. There are other regions where it's much less. Even across countries, half a dozen countries seem ready to seize the opportunity and to ride the wave of digitization, the rest do not. And then the change in the composition of output is such that your tax revenue is at stake. You can not easily tax the rich. You can, of course, wait for global agreements that will solve that, but it will not solve our problems tomorrow. You can try to tax the middle class, as they did in Colombia, and they have been in riots for months since they started trying to tax the middle class. They needed to go down. We need to finance health. We need to finance education. There are social programs that are needed, and we have debts that are 10% higher. So I'm not so worried about growth. Growth could be roaring. I'm really worried about what will come socially out of this pandemic, and that's perhaps where I join Professor David Holm. Thank you.
Thank you very much, Dr. Martin Rama. Actually, that was so fascinating presentation, so interesting, and also it provoked, I think, some of the new ideas, especially when you presented the findings of your new modeling exercise. You know, some of this, I think my friends from India and also my friends from Bangladesh, they will like to probably argue with you, especially with the case of India's, you presented more promising picture, whereas probably some of the data is an issue, and whereas Bangladeshi actual data or the data, official data is showing more promising picture, whereas your modeling exercise is showing a little bit of contrast. So it's not that they don't really match. I think that's very fascinating, and I really look forward to some fascinating questions as well. So we now, participants, we have 2 excellent presentations, and I think so fascinating they are. So I look forward to some questions, comments, and you please raise hand, and I'll let you speak. Also, very briefly, if you can introduce yourself. So who wants to go first?
Can I? This is Mirza Hassan from BIGD.
Yes, of course, Mirza Bhai. Please go
ahead. All right. Question to David. Hi, David. How are you? Okay. This is a speculative question because I'm relying on Martin Rama's presentation that he said that you said, because I came late, I unfortunately missed your earlier part of the presentation. But as Martin Rama said that you said the government, if they wanted, could have gone for a balance between the life and livelihood. Did you say that? Otherwise, my question is redundant. Is that correct?
No, what I was saying is that certainly lives and livelihoods have been presented as a balancing act, but certainly the recent work by Angus Deaton in particular tends to show that that they fit together, that if you keep the mortality and the morbidity rate low, then your economy doesn't get hit to the same degree and the impacts on employment are probably less.
Okay. But I was wondering, I mean, you know Bangladesh very well, you know South Asia also pretty well. If you take into account the political economy aspects of it, do you think this could be a practical recommendation for anyone to go for balancing lives and livelihood in a COVID situation, particularly in South Asian context? As you know, I mean, Pakistan's Imran Khan, at the very beginning, I mean, he was very candid and he said, well, this is not for our economy, where, you know, informal economy reigns, dominates. It's absurd to go for this kind of balance. We have to open up. We cannot go for lockdown. Bangladesh, obviously, one of the champion of easing lockdown at the very early stage. But Bangladesh ruling elites being, they're never candid. They'll say completely different thing, but they do completely different things. Their practice and their statements are polar opposites. My point is, given the political economy imperatives, is it possible, given the structured economy, informal economy, and so on, was it at all possible for South Asian countries to go for this kind of balancing act?
So shall we gather a couple of more questions and then we can get back to you, David and Martin. So what is the next question? Who wants to go next? Yes, please.
I don't want to monopolize the microphone. Salim Rehan, you've already been very generous with me. So if there's someone else with a question, I will defer to that individual.
No, please, no worries. If you have any question, please, Dr. Shibli, you can ask.
Oh, okay. Because my question is a follow-up on what Mirza Hassan mentioned, the balance between, and sorry, I didn't introduce myself. I am an economist from Bangladesh, but I live in the USA. And the balancing act has been a big challenge for many politicians as well as researchers or writers like me. That, as you know, USA, the former president tried to do that. And again, we're not sure if the balancing was done properly because you have to put some weight on life and livelihood. We, I think, went for livelihood, and I don't think there are a lot of regrets. Now, Martin mentioned that in South America, or I know that the previous or the current president of Brazil and some of his other acolytes have advocated livelihood, or you might even say denial, that COVID is gonna pass and we will just get back on our feet. The economic cost is very significant. So the question for Martin, probably for me, is I have personally a psychology of regret. Do you think that the Brazilians have, or the South Americans have, any second thoughts? Hey, we need to have balanced better, put more weight on life or livelihood, or maybe we are doing okay. That's the inevitable price you pay when something external like pandemic or COVID infections come and we don't have much control over that. We just follow the I guess the best advice that we can get from different quarters, and let us not worry about what we call the noise. Thank you.
Thank you, Dr. Shibli. I will take the last question at this round. So who wants to please come forward? Yes, Mir Ashrafun Nahar, please.
Thank you, sir. So actually, I have a minor question to Dr. Martin Rama. As we know that recovery of the economies across the world is expected to be uneven, and large economies directly affect the South Asian countries. On the other side, recovery of any particular countries not only depend on the domestic economy, but also how the other economies recover. So my question is, what do you think? Is these differences among the recovery system will affect the developing countries in the short run or in the long run? If it is in the long run, then what policy suggestion do you want to offer for the quick and sustainable economic recovery for the developing countries? Thank you.
Thank you, Mir. Actually, there is a question now in the chat box. It was sent to me privately, but it's sent by Falguni Sundaram Biswal from India. I think now it has been shared with everyone. So the question is how to deal with the next crisis. If a pronounced economic crisis were to materialize with sharp declines in growth and employment, the scope for effective further monetary easing would be increasingly constrained. So I think both David and Martin, you have got some questions. So may I start with David first and then Martin, please.
Yeah, okay. I think Mir's question is an excellent question. I'm not sure whether I can even provide a half an answer to it, because I mean, I don't think we yet certainly fully understand quite the patterns of mortality and sort of impacts on growth and the factors that that would allow one to try and treat them as separate policy areas, and the factors that mean that they're deeply integrated. And my understanding has probably been clouded by starting the pandemic in New Zealand, where one saw excellent governance, controlling the mortality, managing the social protection very effectively so that livelihoods weren't hit, and in a way managing to escape the pandemic, as compared to the UK, where the government was very active in the lockdown, but never managed to get control of the mortality rate. And that certainly knocked onto the economy for much longer and much more damaging than it probably might have been. I don't know, certainly, I suppose the one thing I would say is that certainly what happened, I mean, particularly in India, but probably in Bangladesh, was seen as policy transfer. And that when governments in South Asia began to think about what do we do, then they looked at the lockdowns that were happening in Europe and maybe moved across to those without really thinking, but can we do this in an informal economy? I suppose the way that's been written about, and whether colleagues from your own institute, Ms. or Imran Matin or others at PPRC will be able to write about it. But anyway, there is this thinking, certainly in Bangladesh at the moment, about whether one could have smart lockdowns so that one can actually, in a way, slow down the transmission of the infection and reduce the sort of mortality and maybe the long COVID effects, but not by closing down the entire economy, by trying to focus on specific parts of the economy that foster transmission in that way. And so I suspect that, if one could imagine smart lockdowns and imagine a political economy that would support them, that is where one would be trying to move. But I mean, as your work shows, one needs a very fine-grained analysis. I haven't looked at Bangladesh, but looking in the UK, it is fascinating to see the influence of different economic sectors and that. And in the UK, we've been incredibly negligent about closing down international travel into the UK. And that does seem to relate partly to the influence of people in the financial sector wanting to travel, and the airline industry and people close to government in that. So one is certainly can recognize the way that even when you apparently go for a strict lockdown, certain elements of that lockdown are not so strict because of the lobbying capacity of other groups. But no, I would think certainly, yeah, don't follow what other countries with very different economies have done if you're thinking of lockdown and responses. And certainly for analysts, see if we could get more fine-grained to understand what parts of the economy might be closed down, might achieve high health effects, but not impact on the economy too much. And closing down the informal sector is not, that option is not really available.
Thank you, David. Over to you, Martin.
Yes, thank you. And I think the first two questions by Mirza Hassan and Abdullah Shibli were very much related on the trade-offs. And let me tell you, let me again share for a moment my slide to try to make these points. So give me 1 second if I can get the right slide. Yes, it is. Can you see my screen now?
Yes, we can.
So remember, this is the figure that shows the cost, the fall in GDP compared to the forecast at the beginning of 2020, and the cost in terms of deaths as measured by excess mortality. Two measures that we agree with. If you look at the red line, you will think that, yes, there is a strong complementarity. You have fewer deaths and on average, and you have a lower decline in GDP. But I'm not sure that we can compare these points in the same way. I'm not sure that if I take Korea and Peru, I'm talking about the same kind of countries. So if I were to say, let's take countries that have a strong government capacity, and here I have Korea, Norway, Japan, seems quite okay. Well, if I take groups like these, then I would say, oh, the slope is the opposite. And there is a trade-off. We have one paper, so let me try to elaborate a bit more on this idea. We have one paper where we followed, not with excess mortality, because we cannot do it, but we follow with official COVID deaths and cases. What happens with lockdowns is like a little dynamic model. What happens with lockdowns depending on for how long you keep them and when do you start. And when do you start ends up being a very decisive thing. If you start late your lockdown, if there is already community circulation, you're probably shooting yourself on the foot. If you start early, they have effectiveness. But when we compare rich and poor countries, the effectiveness is much higher in rich countries than in poor countries. And one can speculate as to what this is. Again, if everybody is salaried, if we have comfortable homes, if government is ensuring that our salary is being paid, well, probably we can manage a lockdown. If we live in slums, if we need to go out, and if there is no water and nobody can do anything or even test to know who is sick and who is not sick, then you're probably doing more harm than anything else. And on the other hand, when it comes to economic activity, lockdowns are similarly harmful. So one of our primary conclusions is that probably the balance in poorer countries is more tilted towards protecting the economy, just because you don't have the means, not because it's what you would like to do. It's because it may be a bit of wishful thinking that you can control the pandemic. Now, in that trade-off was one thing in 2020, and now it's a different thing in 2021. In 2020, because our countries had access to international markets, financial markets, many countries managed to have a substantial stimulus package transferred to households. Many countries in Latin America, where there is a tradition of conditional cash transfers and things like that, had good social registries. So again, the program in Brazil was quite remarkable. Almost everybody in the bottom 60% of the population got the transfer, the Corona voucher, as they called it. So it was very well targeted because they were building on what Bolsa Familia had done before. But Brazil now doesn't have the money to do that again. It's out of the question. They cannot. They spend like 8% of GDP in one go. They will have serious problems with the interest rate if they do that. And what we are seeing is that in Latin America, one way beyond what governments do is how people react. And governments that push it for severe lockdowns are not being very popular, I can tell you. We are going through a wave of elections, and it's one of the concerns of the COVID pandemic. It's not just the death toll and the economic toll, is that people are so upset about what happened that we are going into magical solutions, populist measures of all different sorts. So the governments that appear to be technocratic but ended up not delivering are being wiped off. And so there is another cost that goes into the direction of the bad and the ugly, as Professor David Hume would say, which is that we did not fully internalize the institutional capacity constraints and the role of informality when thinking about what to do in developing countries. The other question was on what to do going to the future. And I would say 2 or 3 things. One is for countries that have debt, work on debt management, because interest rates may go up. And you don't want to have all of a sudden a bulk payment, a bulk having to go to the markets for large amounts of money at a time when interest rates are high. So debt management is one thing. Second, use formalization. If you cannot raise tax rates because people will get completely pissed off, they were suffering death, suffering economically, and now in addition you raise the taxes, but you can broaden the tax base through digitization. You can learn much more about who earns what, and that's something that can be done. Strengthen your health system response and your capacity to respond, your ICU units. So there are several things that can be done. And then thinking that we may not go to the world of the good that Professor David Hume mentioned, of multilateralism and all that. We may not get there. There is a strong appetite in advanced economies in the West to diversify sources of value chains away from China. And countries like Bangladesh, Vietnam are among the most obvious beneficiaries of that. So get prepared to ride that wave. Make the reforms that will make investors want to produce from your country so that at least you get a boost on employment and on export revenue. Thank you.
Selim, can I just follow up quickly?
Of course you can.
Okay.
We have a very limited time, but
Sure. I'll take a few seconds. This is both for David and Martin. Can we speculate, look back in 2020 and speculate that if this government, I mean, sure, poor government, but they had dollar reserve, they had billions of dollars. In the moment of this kind of crisis, I mean, humanity demands, forget economic rationale, humanity demands that they will spend billions of dollars to feed people, say, for a few months. If they had done it in the beginning of the 2020s, for say 4 or 5 months, and in Bangladesh, a famous eminent economist, Professor Usmani, he in fact calculated the amount, so a few billion dollars. Then you could have probably, contained the spread of the virus, and things would have been different in the developing world. Is that something, I'm being populist or something about it, or does it make sense to you?
Very quick answer from David and Martin.
Okay, I mean, I'd say, I certainly in Bangladesh would have been having higher levels of social protection expenditure to try and manage the livelihood side and encourage people to move around less. But I think the thing is, you can't move quickly to that. You do actually need systems, you need registries in place and the processes and the trained staff. So in a way, I think one of the longer term lessons is it's definitely worth improving your social protection, in a way, systems and delivery, so that you're in a position to scale up, in a way, giving away food or social protection should some emergency or crisis hit you. So yeah, I would have liked to have seen Bangladesh spend more, but whether it had the systems, the registers could actually reach people, or whether it would have to be universal, so it would have been extremely costly or badly targeted.
No, thank you. I think, David, I think you raised a very, very important point you actually mentioned, especially that what we experienced last year, when despite our Honorable Prime Minister, she mentioned that the government wants to reach 5 million households, with an amount of 2,500 taka, but they could reach to 3.5 million because the problem of the listing, the data, and the wrong targeting and everything, it was there in the system. So I think it's, but the whole system doesn't really support this, is required, the demand, enhanced demand now, the demand of that time. So Martin?
Yeah, and in the same spirit, I think I will add building reliable social registries as one of the priorities now, because we are not out of the woods yet, and they will come in handy in the future. But going to that retrospective question, Brazil did what you described. Brazil had excellent social registries, distributed a ton of money, and had very bad outcomes, because it was perhaps a necessary condition to have the social transfer, but it was not a sufficient condition. There was not the capacity to do testing and tracing to contain the spread of the epidemic. There was not a good closure of borders. There was a big neglect. In fact, the way countries like China and Vietnam have managed the pandemic is basically to be on complete lockdown at the border. It was not the case in Brazil. So if I look at Brazil, I say, well, they did what you are describing, and they could target very well, and that was not enough. And now, after 1 year, they cannot do that. So if you say, oh, the pandemic is just 5 months, and then after that, we're good, we may be living with variants of the pandemic for several years. So we cannot run this as a sprint, it's a marathon. And we should not go into magic solutions. Probably we need to learn how to live with the pandemic.
Thank you, Martin. I think we are towards the very end of the session. I'll just ask Somesh Mathur, you wrote some points in the chat box. Would you like to speak? Yes, Somesh, over to you.
Thank you, Professor Salim. I'm Somesh from IIT Kanpur in India. My question is that with these COVID fatalities happening among 60 plus population, I was wondering that as far as GDP is concerned, do ideas and experience matter? And my second question, which I've written, is that in India's case, we have peculiar situation. We had a negative 7.3% growth rate in 2021. However, we saw a current account surplus and we saw a BOP surplus, meaning that our exchange rate did not depreciate. Now, you can always say that because of lockdowns, our imports and exports fell down. But BOP surplus includes capital account surplus. So we did invite FDI even in these difficult times, as Dr. Martin said about Latin America, that there were some good things happening. And Pakistan grew at 4% because of cement, because of non-resident incomes, and because textile and leather, they took the business from us, actually from India and Bangladesh. So they did better. And the financial package for the modest. So that's my limited point. Thank you so much for this wonderful session.
Thank you, Professor Mathur. So Martin, any quick response?
No, I think the description is absolutely right. We are seeing a mixture of winners and losers that in some cases are very unexpected. And again, I think it relates to one of the questions we had in the first round, is how to prepare for what is coming up. I think we need to prepare to seize opportunities. The opportunities are coming from China surging and demanding raw materials and food, from the US having a stimulus package that is so big that it will be forced to run a huge current account deficit, from geopolitical pressures to diversify global value chains that may create opportunities. But a lot of the homework is at home, and it involves things like these social registries, managing the debts that we are not caught in a financial crisis, getting better at testing, tracing, learning from improving ICU capacity to handle the emergencies. So there is a long list of things to do. What I'm still unclear is, I think it's very easy to think that, oh, this coming year and 2022 will be horrible years. I think they will be rather turbulent years.
Thank you, Martin. I'll just go to David for his final words. Martin actually showed some kind of cautious optimism, if I can understand his presentation. So David, how optimistic you are? You know the kind of institutional challenges in developing countries, especially you work quite a lot on South Asia and other African countries. Do you think that the governments will be able to manage this, both the economic crisis and the social crisis? Your final set of words, David.
Okay. I think they'll manage it, but some will do better and some will do worse. But I think a key thing is definitely, well, I suppose this may be too much wishful thinking, but recognizing what Martin said, that this is going to be a marathon, and we keep getting these images of battles that will be won. But actually, no, coronavirus isn't going to be like that. It's going to take time, even with the vaccines and whether it can outpace the vaccine. So it is, trying to get politicians to be realistic about we manage it. In that managing it, then you need to be creating capacities so you could deal with it if it got worse or if something else bad happens along. And I think so the social registries, just knowing more about your population, using some of these new methods of getting data sets so that statistical offices actually can spot who's migrating, where people are relocating to, is the way forward. And in a way, it's particularly for this community, maybe it's the message they want to hear, but it is trying to find ways of getting more effective, in a way, science and knowledge into those political decision-making processes. And some people throw their hands up and say it's all politics, but very rarely are political decisions totally stupid, totally ignore the scientific and the technical advice. It's the sort of ways in which they take it. And so finding definitely ways in which one can get the sort of scientific voices into these decisions is one way of trying to get it forward. I think we will manage this. I think we will live with coronavirus eventually, but it's the price that we pay within countries, and that price probably can be reduced, but there are going to be costs for livelihoods and costs for lives, and that will continue.
Thank you, David. To Martin, very final words. You talked about reform, but you also know that in developing countries like Bangladesh, how difficult is actually reform, because there is a reform-averse culture among the political elites. So how optimistic you are, even during this crisis, you mentioned some of the need for some critical reforms. Do you think that our political elites, they will actually undertake these reforms, even in a country like Bangladesh, or if you're drawing experience from Latin America?
No, I'm not optimistic in that respect, in the sense that reforms have been difficult to implement. And now, if you think about the path ahead for many of our countries, which is one of fiscal consolidation, because we cannot continue for too long, it becomes very difficult. You cannot tell anyone, let's cut this expense. What will you cut? Health, education, infrastructure? You cannot tell people, let's raise taxes, because of course, we will all love to say, let's raise taxes on the rich, those who benefited from this. But let's be practical. To me, the experience of Argentina, a country with relatively high capacity, is telling. And so to me, the alternative is do other reforms. Do reforms not of the sort that get people on the street. Reforms like using technology to really know who is doing what, who is earning what. Redesign your social protection programs so that instead of thinking that someday everybody will be working for a formal sector firm, you know that people will be doing this today, that tomorrow. But if you can know how much they are earning, you can enroll them in pension plans, in health insurance plans. Use the innovations that come also in technology from on the financial side. How you design your financial architecture, your digital architecture. The kind of things that, for instance, India did with the payment switch under the central bank, the payment banks. You can design the architecture in a way that is consistent with a liberal society, with privacy, or gives enormous power to certain corporations. Again, that's not the kind of reforms that put people on the street, but you can do it. Same thing on integrating with the world economy through platforms. So I see a range of things that can be done that are more on the nuts and bolts side, that take advantage of the new technologies, distributed generation in electricity, to create competition, but without doing the kind of things that will get the interest groups after you and people who are genuinely fed up with everything that happened, also very angry. It will not work. So we have to be creative, and I think economists can help a lot. Thank you.
Thank you, Martin. Thank you, David. I think it was an excellent session today, and that was the kind of what we expected to conclude our conference with this kind of quality discussion. And we are so grateful to you both. And we look forward to David and Martin to engaging with you in the future too, the way we did in the past. And also, I think I take this opportunity, it's not going to be long, just to take this opportunity to thank everyone, because we had a wonderful conference, I would say, over the last 3 days. I just request all my SANEM team members to turn their videos on if they can. So I also thank SANEM team, Shoaib, Ishrat, Mahatab, Anjan, and Arsha, Junaid, Dr. Bidisha, of course, many others. Probably if I start naming them, it will be a long list, but whoever I can see now, I'm just requesting them to turn to him. Yes, of course. So they have been working for long to make this conference a success, and I'm so grateful to them. And of course, I'm grateful to all the participants and the paper presenters, discussants, chair, and whoever were with us over the last 3 days and also before that. So with this, I close this session as well as the conference. And also, just a small announcement: we are having 2 conferences a year. One is this SANEM International Development Conference, which started last year, and our usual SANEM Annual Economics Conference, which are supposed to be in February this year, but we have pushed back to December this year. So we'll come up with some announcement and everything. So with this, thank you so much, and have a good time, and look forward to engaging with you all in the future endeavors. Thank you.
Thank you.
Selim.
Thank you.
Thank you for having us with you.
Wonderful.